All right, gang, for your 90-90 supported single arm reach, you're gonna get into a 90-90 position here. Now, this is gonna be okay for just about everybody to get into because we are using this support arm. So from the FRC stuff, we normally want you more upright if you can. We'll kind of, tailor it back a little bit here depending on what we're trying to accomplish. But for this breathing drill, we actually want you supported in kind of this hand about 2, maybe 2.5 feet away from your body. We'll get into wide here in a second. So for this 90-90 position, if you can get into the perfect 90-90, awesome. If you have any hip pain, knee pain, whatever, maybe just close that gap a little bit and that should take any stress off the medial knee or some pinching in the hip, okay? So we're here, we want to try and create a nice straight line from knee, hip, shoulder, through the ear and top of the head. So how we do that is try to get into the straight line here with hip extension, but we're also going to do a little bit of a posterior pelvic tilt, thinking about taking your back pockets and pulling them down towards your knee. So small movement, hopefully you saw that. And then from here, rib cage mechanics, also important here. Just take a breath in, exhale, and just try to take your lower ribs and pull them down, but like gently pull them down and pull them back towards your spine. What I don't want you to do is flex forward, okay? So if you feel your six-pack abs, that's too much, too far, you're probably flexing. We're trying to get your obliques to turn on. So exhale everything. Feel your obliques. You're really gonna feel this left oblique here because you're crunching. Now that's why we're in this support position. So I want you to have this arm a couple feet away from the body. I want you to stay active through the shoulder just so you're not sinking into it. This lower rib cage here on the right is kind of shooting towards the ground. That's why you have kind of a little bit of a side crunch here and you're really gonna feel that left oblique. Now, before we get started here, this left leg, I want you to drive it down to the ground so you feel your adductors kick in on this left side. Have that good posterior pelvic tilt, good rib cage position. We're here, we're gonna reach forward and rotate that torso to the right just a little bit, okay? And from here, head goes straight up. Going to take a breath in through the nose, nice and quiet, filling the rib cage. Okay, not the belly. Take a full breath, exhale, open mouth, fog a window. Exhale everything until you feel those obliques kick on. Now this oblique's always going to be on, but you'll feel that full exhale, you'll feel your right oblique kick on. Check in, make sure you're still driving down with this left knee so you have the adductor in, you're still reaching. Hold for about a 5 count and then take your second breath. So again, nice quiet breath in through the nose, expanding the rib cage. Exhale, fog a window. Exhale everything until you feel that right oblique kind of kick in again. Okay, so as you're breathing, you're not losing your connection with your obliques, but when you exhale, you're gonna feel it kind of kick on a little bit more. Okay, guys, that's your 90-90 supported single arm reach.